I'm Rod Rohrich. I'm a board-certified plastic surgeon from Dallas, Texas. Welcome to Rohrich Knose podcast. The goal of this podcast and YouTube is to help you become a better you, a more educated you, a smarter consumer. We're going to be talking about not only plastic surgery and medicine, but so many other things that will help you and educate you to be not only an informed consumer, but to find the right physician, the right healthcare facility for you and your healthcare. So today we're going to start by talking about breast implants and breast augmentation. It's one of the most common topics in cosmetic surgery that we talk about today, and it's also some of the most controversial. So what you'll find is that we'll always have a world expert. And today we have the world expert on breast implants and breast augmentation, Dr. Bill Adams. Welcome, Bill.
Thanks, Rod. Great being here.
And Bill is the founder of the Plastic Surgery Channel. In fact, we're recording it here at the Plastic Surgery Channel, which is a very innovative concept that talks about plastic surgery and the hot topics in all of plastic surgery and beyond, and gives you the truth about what's really going on. So Bill, not only is a board-certified plastic surgeon, he's a past president of the Aesthetic Society, which is the largest society of board-certified plastic surgeons dedicated solely to aesthetic surgery. And as I mentioned, he's a co-founder. He's a founder of the Aesthetic Surgery, not only of the Plastic Surgery Channel, and he's not only a phenomenal surgeon, but he's an educator, and I like that. I like people that give back, and Bill gives back. So Bill, we're going to talk about breast augmentation and breast implants. So you ready for the top 10 questions?
Absolutely. And I'll just say, Rod, I think this concept for your podcast is fantastic because, as you know, there's so much misinformation out there. It's much different than it was 20 years ago, right? Because there's so much out there, so much misinformation. So you've got access to the world's experts, and you've been all over the world, right? Yep. You've done all things. You've been editor of the biggest journal in plastic surgery. You've been past president of the ASPS. So you've done a lot of things. So you know all the experts. And so people are starving for the right information because there's so much misinformation. This is a great topic because there's tons of misinformation about breast implants and breast augmentation. So let's get into it.
Let's get into it. Yeah, and I just want to play off that, Bill. You're right. And that's one of the reasons actually why we're doing this, because I see so many people on Instagram and TikTok that they don't even come close to being experts in their field, and they're talking about stuff that really is not necessarily right. So that's why I actually got involved in social media. And so we're going to give you the truth about what's happening now from real plastic surgeons about real surgery. So let's talk about breast implant.
Top 10.
Top 10. So patients come to you, and so what they say, first of all, they've researched you and they want to talk about breast implants and breast augmentation. So they say, am I a candidate? Am I a candidate for a breast augmentation?
Well, you probably could be, but first of all, there's a lot that goes into it, and it's not like buying a pair of shoes. Sometimes patients think that. Are they doing it for the right reasons? Most of the people we see are doing it for great reasons. They're doing it for reasons like they want to fit better in their clothes, or say they had 3 children and their breasts changed. And they just want to kind of get back to where they were before they had kids. And those are great reasons to do it. Now, obviously, what are bad reasons? To get a better boyfriend, something like that. That's rare, but that's not a good reason to necessarily consider doing breast implants. But I think the vast majority of people, I'd say 99% of the patients I see are doing it for their own personal reasons. They're not doing it for anybody else. And those are the people that do fantastic.
Right. No, I agree. And that does bring up, we live in Dallas, Texas, and sometimes I've seen, mothers bring in their daughters and they're not even 18. They said, well, my daughter wants a breast augmentation. So that's a no-go. So should they have their kids first, or what do you think, Bill?
It depends. Obviously, if they're actively trying to get pregnant and they're like, I'm going to get pregnant in the next 6 months or a year, I usually counsel them, you should just wait till after you're done having kids. Now, there's some people who say, I'd like to have kids, but I'm 23 years old, I'm not married, I have no plans in the immediate future, and I want to do this for myself. And I think it's fine to go ahead and do it at that point. We have a lot of patients that have children after having implants, so they can breastfeed. There's no restrictions on them. It's just like they didn't have an implant,
Right.
So
and that's another myth about breastfeeding. Of course, they can breastfeed after implants, saline or silicone, and we'll talk about that in a little bit. What's the youngest age should you consider for cosmetic breast augmentation versus the other?
Yeah, it's interesting because so saline breast implants are approved for 18 and up. And,
is there any science for doing that other than the FDA?
Well, silicone is 22 and up. And actually, I know I was a medical director of one of the clinical trials. The data actually was better for silicone in the younger patient population, but it's more of a political decision,
right?
Which is actually, I think, demeans women a little bit, because it kind of says if you're 20 years old, you're not mature enough to make an informed decision about having what type of implant, which is ridiculous.
Right.
I meet some women that are 17, 18 years old that are way more mature than 40-year-olds I meet.
Yeah. So same here.
So it's a difficult decision sometimes, because there are patients, and we'll see even younger patients that it's not for cosmetic reasons. Say they have Poland syndrome,
right,
or they have some congenital breast abnormality, and
they're candidates for silicone gel. Like
yes,
they have significant asymmetries, right? Yeah.
And sometimes the silicone implants are actually superior because of women that don't have a lot of soft tissue and things over time. So it's not a clear-cut decision. But again, that's why you need to go to somebody that's not only a board-certified plastic and reconstructive surgeon, but somebody that actually is an expert in doing breast implant-based surgery, because not everybody does it every day, and that's what you want.
Right, and I think that's very important. We're always going to talk about, finding an expert, finding the best you can find for your needs, whether it's a breast augmentation or rhinoplasty, because if it's something that you do once or twice a year, that's probably not a good thing to do. Just because, I'm a hand surgeon, but if I'm just doing hand surgery, I probably wouldn't be doing breast surgery. I mean, I only do the things I'm really good at and I'm an expert at. So that brings up a good point. So what about this whole issue? Are they safe? The mother comes in with her 19-year-old. Are these safe operations, Dr. Adams?
Absolutely. The operations are very safe, and there's been a lot of advancement of the surgical aspect of breast augmentation in terms of recovery and things like that. I mean, patients have really fast-track, easy recoveries from these procedures. And now, then we get in the safety of the devices and the implants. And there's been a ton of science, as you know, Rod, over the years about the safety of breast implants. Now, especially with social media, there's been so much noise with this, and it's still a debated topic. It's been debated for as long as I can remember in my career of plastic surgery. Right. But you have to look at the science. It's probably beyond the scope of this discussion, but
we'll talk
in terms of the science that we all know and would quote and think is the best science, yes, the implants are safe.
Yeah, they're safe. And really, it's actually silicone is the most studied implant and device in all of medicine. And there's a lot of things in medicine that aren't so studied that are used a lot in orthopedic surgery, ophthalmology, and other areas. So it is very studied. The science is good. It's a myth over the reality. So tell us about the different types of implants. I mean, in brief, when you're talking to your patients, they say, okay, I heard about saline and I heard about silicone. I heard that saline may be safer or last longer. What are the 5 key facts that you tell your patients?
You say you have silicone and saline implants.
They're both FDA approved,
right? And actually, you can do well with either implant. Now, some patients may, for various reasons, choose certain types of implants. If you look around the world, silicone implants are by far the most commonly used implants.
Right.
We in the United States had an experience with saline, so there are saline implants that are used in the United States, but across the world, really, that's not the case. People don't use saline. That being said, like I say, you can get a very nice long-term result with the properly done saline breast implant. I think it's the feel of the breast. Sometimes people feel that silicone implants feel a little bit more natural, like a typical breast. It also has probably a little less changes over time than a saline implant. But even within those categories, especially with silicone, there's a lot of different types of silicone implants, they're shaped or anatomic shaped implants. There's round implants. Typically, round implants suit most patients very well. There's other types of surface texture.
Yeah.
So there's hundreds of choices. And again, that's why you need to go to somebody that can not only educate you about all these different choices, but then help you choose what's going to be the best thing for you.
Right. So let's hone down a little bit on that. So how long do implants last? We hear 10, 15 years. I mean, what's the real story? Which also then follows up, when do you replace them, or what's the right time?
So there's been 6 generations of implants since 1962 when
Wow.
silicone breast implants were first started by Cronin and Giroux in Houston, Texas.
Right.
Again, another Texas.
Another Texas innovation.
Yep. And so there's 6 generations. The implants that were called the second generation implants, those were very thin-walled, thin-gelled implants. And so those only pretty much all were leaking or ruptured by 10 years. And that's where this mantra that implants should be replaced every 10 years comes from. That's from the 80s and early 90s. Now we're at generation 6 implants. They're very different devices. The data on those implants is now, and I'm following a lot of these patients now. These were reapproved in 2006, so we've got patients that are about 16 years out with them, longer because of studies. But at 20 years, 80+% of those implants are still fine.
Right.
So what we do, I tell patients, you don't need to replace them at any specific time point. We follow you every 5 years. We'll do an ultrasound. That's been a great advancement for patients. The original recommendation was MRI. No patients did that, and that was really a problem. And the FDA finally, in the last advisory committee meeting, agreed that MRI was probably not the best choice, and actually it's probably not that even as accurate. And just ultrasound is a great modality to look at the implant. We're not looking at breast cancer and things like that. We're looking at the shell of the implant, and you can tell very quickly if the implant's intact or not. So we have our patients come in every 5 years.
Right.
It's a great way to do it.
And I like that, because basically what it is, it's a there's no radiation, it's high resolution, it's very safe, and it's very accurate in these higher resolution ultrasounds. And I think that's smart. So nothing lasts forever. Death and taxes, but nothing lasts forever. And implants last a longer time than we've thought in the past. And of course, with saline implants, obviously if they deflate, and you'll know, my patient will call me that morning, and they're both safe. I think we should all, they're both safe. They're both FDA approved, but it's really up to the discussion you have with your surgeon. Now, today, Bill, round, smooth implants, and of course, we've really gone away from any textured implants to smooth implants. Just tell us a little briefly about that discussion you have with patients and why.
In the United States, smooth implants have always been the lion's share of the type surface texture of implants. A textured implant looks like a rougher surface on the surface of the implant. It's funny, and you know this, right? If you go internationally,
I know.
all they use is textured implants. Even through the breast implant ALCL saga, it still is something that holds true. They use different types of textured implants, but they believe texture is important for certain reasons. I'm not sure that those reasons, it's usually that they cause less capsular contracture. I think that's probably been disproven now with the data. But there still are textured implants, but I think in the United States, most surgeons and most patients are really using smooth implants.
Right. No, I agree. And Bill touches on, obviously, a sensitive situation. And I'm going to ask you to explain ALCL and why that's important. But basically, in the U.S., we use smooth round implants, Generation 6, because they're safe. They're very scientifically proven to work well. But, what is ALCL? I know it's a rare disorder, but it's a real disorder. And of course, that's why in the U.S., obviously, we're very litigatious prone. So we want to make sure we do the right thing for our patients.
Yeah, I think that the key points of breast implant-associated ALCL. ALCL is a rare lymphoma that's been associated with certain types of breast implants. And the important thing is that when it first, it's something that we really didn't know anything about until about 10, 12 years ago, when there were some of the cases, and actually Gary Brody kind of brought this to attention. And initially, felt like it was caused by one specific type of implant, which is really, we found that's not initially the case. It's actually been seen in every textured implant, but at varying degrees of incidence.
Right.
So the more textured, the more rough the surface area of the implant, the higher number of cases. And subsequently, as you know, those higher macro texture implants were removed from the market worldwide, so they're just not even available anymore. And again, in those, it was a real disease. There were some patients that died, although it's a very treatable disease. So the vast majority of patients, actually every patient that I know of that had been diagnosed with ALCL that had been treated appropriately has been cured from it.
Right.
And so that's good. But there are the other types of textures are still around, and you can still use them safely.
Right.
But the incidence is very low. So we're talking like maybe 1 in 80,000. But the other important point is that in smooth implants, there's never been a pure smooth only case of ALCL.
Right. Do you hear that? Never been. And I agree. I'm not, knowing the literature and being passed out of the journal. And that brings up the next point. Okay, people have talked about, and of course this comes from the 90s, do they cause breast cancer or do they disguise breast cancer? And the answer to that is resoundingly no.
Yeah. And in fact, it's curious, but the incidence of breast cancer in patients with implants is lower than the general population. And nobody really exactly knows why that is, if there's some protective effect. It is true that with an implant, sometimes patients can feel things more readily. I think the other thing that comes up is mammograms. It used to be early on, when you were my residency director and chairman, Rod, I remember the studies were saying, the mammograms, there's some issue with mammograms and implants, but that's really not the case anymore because I think most of the centers have mastered the technique of mammograms with implants. And the other thing is that if there ever is any issue with them seeing something, they can do MRI as it'll back up to it. So
and FJ, I actually tell all my patients if they're getting a mammogram, I always tell them to get a high resolution ultrasound because that actually helps them with high density breast tissue. So that's a little quick pro on just being safe. And so that brings up, so do you get mammograms on everybody pre-op if they're under age 40? Unless they have disease or history?
We follow the American Cancer Society guidelines. Actually just changed. They just changed it to 45. It used to be 40 now it's 45. But what we do is if somebody has any family history of breast cancer, we do get a mammogram. We ask them to get a mammogram, and then we've always said, so when the recommendation was 40, we typically would tell people they're 35 that they might consider getting a mammogram just to get a baseline mammogram because they would get one when they're 40, and now we're probably going to say at 40 to do that. So
yeah, no, I agree. Safe is better. If they have any history on either side of their family, BRCA gene, we get baseline mammogram and ultrasounds, and then at 40 or above, you get them. And there's nothing. So tell me about fees. That's always the hot topic on Instagram. And, people go and they call half the time, when we get phone calls, it's the tire kickers, that they're asking about fees. So, the thing is, the cost is very important, but so is your risk and your result. So, and they vary around the country. So, Bill, how do you handle that when they say, well, Dr. Adams, I'd love to have you do my surgery, but you're just too expensive for me.
Yeah, well,
I get that every day too.
Yeah, and I think that it's the old adage that just because something costs less, sometimes the effects of that may be worse. You can kind of get what you pay for. And,
right. Walmart versus Neiman Marcus.
Yeah, it's so yeah. There's a big variation, but in general, if something's really low cost, I think you got to be really wondering, what's going on. And it's not just, the surgeon is one thing, but also what other things, centers, the operating, where's it being performed? What are the facilities like? Right. It's just, this is a luxury procedure. You want to do it safely. You want to get the best result. And sometimes, if you go down that Y in the path when you're going bargain basement, you get some problems. The rest of your life, you may be paying the price for that. Whereas, so it's kind of, it's a premium procedure, and cost should be the least part of your decision making.
It's an investment in you. It's an investment in yourself, in your body, in your face, or your nose. And I think that's why I always tell them, because it's not just a one-shot deal. I follow my patients forever. I don't charge them for follow-ups. I want to see them. Right. So I think what you mentioned, Bill, is very important. Board-certified plastic surgeon, an expert in what they do. The use of anesthesiologists. I prefer anesthesiologists or CRNA, an accredited outpatient surgery facility. In fact, if you're a member of our society, of the American Society of Aesthetic Plastic Surgeons or the ASPS, you have to have and operate in an accredited facility. You have to have a backup where you can go to a hospital. And all of these things that are very important, because it's all about safety and outcome. It's not just saying I want bigger breasts. I want to live and to enjoy them. So, that's the take-home message here. And yeah, you can go to North Dallas or Oklahoma or someplace and find somebody who's not even a surgeon to do them in their office, in a broom closet or something. But I can tell you, we've seen those people in the ER at midnight, and they aren't doing well. And plus, nobody will see you.
Yeah, I always find it intriguing that people will go to these, like you say, Rod, these are people that aren't surgeons. They're not actually, they didn't do any surgical training. They may be an ER doctor, or they may be internal medicine doctor, and they may be very nice people, but they're not surgeons. It's like you get on an airplane and you got a guy, you think American Airlines is going to hire like a drone pilot? The guy can fly a drone really well, but he's never flown a plane to fly the 747? No way.
No way.
It's just, and that, I don't actually understand why state medical boards don't take a harder take on this, because that is a big problem in aesthetic surgery. And again, I just was president of the American Society of Aesthetic Plastic Surgery last year, and we support aesthetic surgeons, and we have the biggest international group of aesthetic surgery experts, as in the world. But it's not apples to apples. There's people out there that have no training. They market well. They get on social media. They have cool looking websites, and patients really need to do their homework, because it's just not safe.
Right. No, I agree. And I think, it's safety, outcome, and all of that hones down into one thing: finding the best surgeon that's an expert in what you do. That doesn't mean you're going to get a perfect result, but it means you're going to have a safe and good outcome in a high majority of patients. So it's okay. The patient decides to have the breast augmentation. They come in, they do it in your outpatient surgery center, come in, go home. Tell us a little bit about that, and then also their recovery and post-op. Tell us about that.
Well, we really emphasize what we call the process of breast augmentation, and that's actually something I published in PRS, Rod, like 16, 17 years ago. But it's not just placing an implant in the pocket. I think that's what people think of, say, breast augmentation. It's just surgically putting an implant in the pocket. Well, that's one part, but there's many other parts. So, patient education is the first part, and then picking the implant properly. We pick an implant that fits the breast, and then doing the surgery. We do the surgery very different than we did it 25 years ago.
Right.
We did it very precisely, under direct vision, minimal trauma. And then the post-op recovery phase, patients know exactly what to do. We give them very specific instructions, because the more patients know, the better they do, and the less surprises they have, the better they do. But so the experience of the patient now is far different than it was 20 or 25 years ago. Yeah. That's when people were in bed for a week or two and they couldn't do anything. Now people are out shopping the day of surgery. They don't have to take any narcotics. They have a fast track 24-hour recovery, and it's just a fun, easy experience. Right. And I've had 2 patients in the past 2 years that told me that they wish they could do the procedure again because it was such a fun experience. And I'm not joking about that. And it's like, they can't do it because they already had the surgery. But it's incredible how well these patients do using this kind of high-level techniques.
You're absolutely right. And Bill is very humble, because he and the late John Tebbets really revolutionized how we do breast augmentation. It's a very sequential, rapid recovery, no-touch technique, and the minimal use of opioids. I mean, it's unbelievable, and it really works. They're out and about. It makes it so seemingly almost stress-free. Now, none of my rhinoplasty patients ever say they want to do it again. They like the result, but they usually don't say, I don't want to do that again, because they don't like it when, lady pulls out those splints. So, that's awesome. So, Bill, you bring up a great point about people not reading instructions. I don't know what it is. I mean, it's millennials, but I will tell you, they don't read them. And I give it to them 3 times. They get it in their informed consent. They get it in the day of surgery again. But I give them my cell number. So then I just always, when they call me and they said I was on Google, I said, Dr. Google's is not a doctor. He's wrong 80% of the time. And call me, stay off Google. And I think that's just so worthwhile. And that's why I just let them call me.
He's the drone pilot.
The drone, Google. Right. Yes, the drone pilot. Or I was on Instagram and go, oh my goodness, seeing these people aren't even plastic surgeons talking about breast implants. So, I mean, I'm sure you experience the same thing, right?
Absolutely, yeah. It's a problem.
It's a problem. So, just know before you go, and, make sure you can talk to your surgeon post-op. I can't believe sometimes people say, oh, I only get to talk to, the PA or something. I mean, talk to your surgeon. If they don't want to talk to you, you probably don't want them as your surgeon. Bill, let's summarize, in the last few minutes about know before you go. what they need to look for, like the 5 key points from a board-certified plastic surgeon and beyond. What should they look for in these last few minutes?
Yeah, I think really making sure you do your homework. It starts with doing your homework, doing the research, picking, and maybe don't pick one person, pick a few people.
Right.
There's a lot of good people around, but do your research, pick a proper surgeon, somebody that's an expert in this procedure, and then you want to connect with your surgeon. That's true of any plastic surgery procedure, including this. But you need to kind of go through the process of learning about it, being educated. I think one thing we haven't talked about, I mentioned briefly, we pick implants that fit people's breasts.
Right.
That's really important. I think sometimes patients, again, social media, access to information, they come in for the consult, they make a great choice, and then they talk to their friends, and their friends say, well, you should go with a bigger implant. And so, and in some cases, it's fine to do that. You can still do that within reason, but if you make it all about volume, it's not going to give you your best result. And in fact, what we see patients coming to us for revisions because their implant was too big, and they say, it makes me look fat or big. And so you got to be careful of that. So I think that's another important tenet. And then, you just want to follow whoever you go to. It's not, everybody doesn't do things the exact same way, but follow the instructions that your surgeon wants you to do, because
wow, what a novel thing.
Yeah.
Most of my patients don't read them either.
Not what somebody in social media is saying. Again, it's like the Dunning-Kruger effect, in social media. Right. It's like you need to follow what your surgeon does, and then long term, you just really you're going to live your life like you normally would, but there's some things you do need to continue to see your surgeon. You want to have long-term follow-up. You would probably want to do an ultrasound every 5 years to check the status of your implant, and those things will serve you well. Yeah,
and I think you bring up the good point about size, and the reason I didn't talk so much about it, because that's really when you find a real board-certified plastic surgeon, they will have that conversation with you, and they're not going to do crazy stuff. I always talk about in one of my tenets, don't do crazy stuff. Don't come in, and we're going to talk about extreme plastic surgery in another episode, putting in these huge implants that are disproportionate, that don't look good on you, and that's not a good thing. And I actually personally blame the surgeon as much or more than I think the patient, because you shouldn't do that. And, I don't want to partake in anything that doesn't look good, and neither do you. So the whole shaping, sizing, if you find an expert, they'll guide you. They'll do the right thing for you, because, you want to be your best you. So I think in summary, this was an excellent overview, Bill. Thank you so much for doing this. I think everybody should think about this and listen to this, and then go see a board-certified plastic surgeon in your area that really cares about your result. And that's really what we do on the Rohrich Knose podcast. We want you to be a better you. So please, like and subscribe. Give me your comments. Tell me exactly what you liked, what you didn't like, and what are things you'd like to hear about, what other episodes you'd like to hear about. And I want to personally thank the Plastic Surgery Channel and Dr. Adams for this amazing educational episode. Thank you so much, Bill.
Great.
You bet. Live the dream.